Hi everyone, welcome back to your channel. I love pharmacology, and in today's session, let us learn about the important chemotherapeutic agent that is aminoglycosides. Myself, Dr. Padmanabha TS, Faculty of Pharmacology. So let's begin with aminoglycosides. So as you can see here, the aminoglycosides. So how to remember some of the very important things about the aminoglycosides. So this aminoglycosides, so they end with sides. So side means sidal. So these are bactericidal in nature. Bactericidal in nature. So you need to remember one mnemonic, that is G ants cannot kill anaerobes. So they are not effective against the anaerobic infections. So G stands for gentamicin, A stands for amikacin, N stands for neomycin, T stands for tobramycin, and S stands for streptomycin, which is used in the treatment of tuberculosis. Previously, it was classified under the first line antitubercular drug, but as of now, currently, they are not classified under first line antitubercular drugs. So let's see the mechanism of action of aminoglycosides. So aminoglycosides will bind to the 30S ribosomal unit. Then it has got three important mechanisms. So the three important mechanisms can be remembered as: it blocks the transallocation process, it blocks the transallocation of the peptide chain. So A stands for allocation block, transallocation block. M stands for there will be misreading of the mRNA, thereby there will be a inadequate protein synthesis or deficiency in the protein synthesis. IN stands for it is a irreversible inhibition in the initiation complex. So initiation complex will not be initiation. So the three mechanism of action is: there is a block in the transallocation of the peptide chain, there will be misreading of the mRNA, and there will be irreversible inhibition of the initiation complex of the protein synthesis. So basically aminoglycosides will going to inhibit the protein synthesis. The O stands for it requires oxygen is required for uptake. So that's why they are not useful against the anaerobic infections. So G stands for they are effective against the gram negative rods, and also they are useful in the GIT surgeries, especially the neomycin is used in the case of GIT surgeries. So say. So it's go with synonymous rhyming words. Lysine, that means it has got synergistic activity with the beta lactams. And C stands for it cannot kill anaerobic infections. O stands for ototoxicity, which is a side effect, and side stands for sidal. So these are the mechanism of action. And what are the important three side effects of the aminoglycosides? This can be remembered as NOG or gone. G stands for geophrotoxicity, that is nephrotoxicity or renal toxicity. O stands for ototoxicity, infection. Ototoxicity means the toxicity which will going to affect your ear, and NMB stands for neuromuscular blocking. So since it causes neuromuscular blocking, it is contraindicated along with the myasthenia gravis. And since it causes ototoxicity, they should not be used in combination with the loop diuretics, as loop diuretic will also cause ototoxicity. And in pregnancy, they are contraindicated because of the teratogenic effect. So how do they develop the resistance? By the transferase enzyme, which will going to inactivate the aminoglycosides. So they are going to inactivate the aminoglycosides, acetylation, phosphorylation, etc. So in general, coming to the summarization, aminoglycosides will basically a protein synthesis inhibitor. Side means they are sidal in nature, bactericidal. They what are the three important mechanism of action and three side effects? Three important mechanism of action is after binding to the 30S ribosomal subunit, it will going to block the transallocation, misreads the mRNA, and irreversibly inhibit the initiation complex. What are the three toxicity? That is gone. That is the renal toxicity, GFR toxicity, ototoxicity, and neuromuscular blockade. Hope this was useful in understanding the concept of aminoglycosides as a chemotherapeutic agent. Thank you.